Seniors, stop everything for a moment and listen closely. What if the way you sleep tonight could quietly increase your risk of stroke by morning? Every year in the United States, more than 795,000 people suffer a stroke. Nearly 140,000 of them die. That means someone dies from a stroke every 3 minutes and 45 seconds. Even more alarming, approximately 30% of all strokes occur between midnight and 6 a.m. while people are asleep, completely unaware that something dangerous is happening inside their brain. I'm Dr. R. Wilson, and what I'm about to reveal could protect your brain starting tonight. There's a common sleeping position that many seniors use every night, thinking it's comfortable or natural. But that position may be restricting blood flow to your heart and brain, putting dangerous pressure on weakened vessels, and silently raising your stroke risk while you sleep. If you are over 60 and you experience morning dizziness, headaches upon waking, neck stiffness, or that foggy feeling that takes hours to clear, these are not just getting older. They are warning signs that your sleeping position may be compromising circulation to your brain and heart. In the next few minutes, I'm going to rank 5 sleeping positions from safest to most dangerous. More importantly, I'll show you 2 positions that clinical research shows can genuinely protect your brain and heart overnight. But first, I need to know your current habit. Comment below with one word: back, right, left, or stomach. In the next 60 seconds, I'll tell you if your habit is on the dangerous list. Let's start with the positions you should avoid. Position number 5, sleeping completely flat on your back with zero elevation. This feels natural for many people. Your spine is straight. Some swear by it. But here's what your body is actually doing when you lie completely horizontal, especially after 60. Blood pools toward your head because gravity is no longer helping drain it back to your heart. In your 20s, your blood vessels are flexible enough to handle this. After 60, those vessels stiffen. The tiny arteries in your brain become fragile. When blood pools in your head for 7 to 8 hours straight, intracranial pressure builds. That pounding headache you sometimes get at 3 a.m., that's not random. That's your brain being squeezed by excess blood volume that can't drain properly. Research published in the Journal of Clinical Sleep Medicine found that even a 15-degree elevation of the head significantly reduces this pressure and improves blood flow back to the heart. Someone wakes up dizzy or lightheaded after sitting up too fast. They think, "I'm just getting older." No. That's a warning sign that blood flow dynamics during sleep aren't working properly. Position number 4, sleeping on your right side, especially if you have any history of high blood pressure or heart issues. Your heart sits slightly left of center in your chest. When you lie on your right side, your body weight shifts, and one of the largest veins in your body, the inferior vena cava, gets compressed against your spine. This vein returns blood from your entire lower body back to your heart. Even mild compression means your heart has to work harder to pull that blood back in. For a healthy 30-year-old, it's not a big deal. For someone over 60 with borderline heart function or high blood pressure, your heart is already working overtime. Add 7 hours of extra workload every single night, and that cumulative stress doesn't show up on a daytime blood pressure reading. It shows up as a stroke at 4 a.m. The European Journal of Heart Failure studied sleep positions in heart patients. Left-side sleeping was associated with better blood flow stability and less strain on the heart overnight. Position number 3, using 2, 3, or even 4 pillows stacked under your head. People do this thinking it helps with breathing, acid reflux, or sinus drainage. Some elevation does help, but excessive elevation creates a different problem. Your neck bends forward dramatically. Running along both sides of your cervical spine are the vertebral arteries, critical blood vessels that supply your brainstem and cerebellum, the parts of your brain that control balance, coordination, and consciousness. When your head is pushed too far forward, these arteries get compressed. You won't feel it in the moment, but over time chronic compression reduces oxygen delivery to these vital brain regions. Ever wake up with a stiff neck and a dull ache at the base of your skull? That's not just muscle tension, that's restricted blood flow. The Journal of Manipulative and Physiological Therapeutics examined how neck position affects vertebral artery blood flow. Extreme forward bending measurably reduced flow. If your neck is in a compromised position for 8 hours every night, the cumulative effect matters. Position number 2, sleeping in a tightly curled fetal position. This feels protective and instinctive, especially for older adults. But from a physiological standpoint, it creates two major problems. First, your lungs can't fully expand. When you curl up with your knees to your chest and your chin tucked down, your rib cage compresses. Every breath you take all night is shallower than it should be. You know that feeling when you wake up and can't take a deep breath right away? That's because your lungs have been working in a restricted state for hours. And when oxygen intake drops even by 10 to 15%, your blood oxygen saturation decreases. For someone with cardiovascular issues or early lung disease, this reduced oxygenation stresses both your heart and brain. Second, your neck and upper back stay under constant tension. Small blood vessels around your cervical spine get compressed. Blood flow to your brain decreases. Research in respiratory physiology and neurobiology showed that body positions involving significant spinal flexion reduce tidal volume, the amount of air you inhale per breath, over an entire night. Position number 1, the most dangerous, going to bed within 2 hours of eating a large meal or drinking alcohol. This is the single most dangerous habit on this list. Evening dinners, social drinks, it's part of life. But from a cardiovascular perspective, this combination is catastrophic. When you eat a large meal, your body redirects blood to your digestive system. In younger people, the body compensates. In older adults with narrowed arteries, this redistribution can trigger dizziness or even fainting during sleep. Add alcohol, which dilates blood vessels and causes a sudden drop in blood pressure followed by a rebound spike. These wild fluctuations stress vascular walls in already weakened vessels. This can cause rupture or clot formation. The American Journal of Hypertension studied alcohol consumption and nighttime blood pressure. Even moderate alcohol close to bedtime disrupted the normal blood pressure dip that should occur during sleep. When that natural dip doesn't happen, cardiovascular strain increases dramatically. The combination of a heavy meal plus alcohol within 3 hours of bed creates the perfect storm for a stroke or heart attack between 2 a.m. and 6 a.m., the exact window when most strokes occur while people are asleep. Now those are the positions and habits to avoid. Here are the 2 positions that can genuinely protect your brain and heart tonight. Protective position 1, left side sleeping. Your heart sits slightly left of center. When you sleep on your left side, gravity helps blood return to your heart instead of fighting it. Your heart works less. Blood circulates better. Your brain gets more consistent oxygen. About 10 years ago, researchers discovered the glymphatic system, your brain's waste disposal system. While you sleep, this system flushes out toxins, metabolic waste, and proteins that contribute to Alzheimer's. Studies in the Journal of Neuroscience show the glymphatic system works most efficiently when you sleep on your side, particularly your left side. Left side sleeping optimizes waste clearance, reduces strain on the heart, improves breathing, and helps with acid reflux. To train yourself, use a body pillow in front of you. It keeps you positioned on your left and supports your spine. Place a smaller pillow between your knees to prevent hip and lower back strain. Protective position 2. Back sleeping with gentle elevation. Not flat, not sitting up. A gradual incline raising your upper body 15 to 30 degrees. You can use a wedge pillow or an adjustable bed. The key is elevating your entire upper body, not just your head. Why does this work? Blood returns to your heart more efficiently from your lower body. Pressure inside your skull decreases, reducing risk of small vessel rupture. Breathing improves because your airway stays more open. If you have shoulder arthritis, this position may offer relief. If you have heart failure, left side is usually better. The point is to understand why these positions work and apply them to your specific situation. Your bedroom environment also matters. Keep the room cool, 64 to 68 degrees Fahrenheit / 18 to 20 degrees Celsius. Cool temperatures help your core body temperature drop, triggering deeper sleep and naturally lowering nighttime blood pressure. Eliminate blue light after 9 p.m. Blue light suppresses melatonin and delays deep sleep stages where real recovery happens. Use proper neck support with one contoured pillow instead of stacking multiple pillows. Consistent, low-level white noise can mask irregular sounds that jolt you out of deep sleep. These aren't optional recommendations. These are variables that directly affect stroke risk. Here's what I want you to do tonight. Pick one adjustment. Switch to left-side sleeping, elevate your upper body 15 to 30 degrees, or finish dinner at least 3 hours before bed. Start there. Give it 7 days. Pay attention to how you feel in the morning. Fewer headaches, clearer thinking, less dizziness. Your body will tell you if it's working. Drop a comment below. Which habit are you changing first? Back sleeper, right side sleeper, or someone who eats late? Your answer might help someone else recognize a pattern they haven't considered. If this video gave you information you've never heard before, hit that like button and share it with someone over 60 who needs to see this. A parent, spouse, friend, or neighbor. Disclaimer: everything shared in this video is general educational information based on published research in cardiology, sleep medicine, and vascular physiology. It is not personal medical advice. Sleep position and bedtime habits can affect cardiovascular and brain health, but individual risk depends on many factors. If you have concerns about stroke risk, high blood pressure, heart disease, or sleep issues, please discuss them with your own physician who knows your full medical history. This is Dr. R. Wilson. Protect your brain. Sleep smart. I will see you in the next one.